many EMS providers talk about patient abandonment in absolute terms. Some believe that when an EMS provider initiates care, they can't turn over the care of that patient to a lower level provider and that they must stay with the patient until they reach the hospital. This simply isn't true. The law when it comes to patient abandonment is much more nuanced than that, and it totally depends on the circumstances. With all the changes happening in EMS, from community paramedicine to treat no transport, this is a good time to refresh your knowledge of patient abandonment. Legally, EMS patient abandonment is termination of a provider-patient relationship when continued care is necessary, but the provider makes no provision for continued care by another qualified provider. Legally speaking, abandonment is a form of medical malpractice referred to as nonfeasance. Let's look at two examples to make this point more practical. First, let's say that an ALS unit and a BLS unit are both dispatched to a call for an unknown medical. Upon arrival, the ALS provider assesses the patient and finds the patient had 3 days of mild abdominal pain without any complicating signs or symptoms, no other acute medical or traumatic condition, and requires no ALS care. The ALS provider, following her system's protocols, releases the patient for transport by BLS. Now, this does not constitute patient abandonment. Now, it's true that an ALS provider is transferring care to a BLS provider, but the medic has first assessed the patient and determined that BLS care is appropriate. Federal Medicare regulations even specifically allow for payment for an ALS assessment when no ALS interventions are needed. Now, second, on the other hand, suppose an ALS provider assesses a patient and determines the patient has acute chest pain and shortness of breath, but releases the patient to BLS without furnishing any ALS interventions. In this case, the clear standard of care requires ALS treatment, but the ALS provider failed to furnish it. This would constitute abandonment by the ALS provider. Now, as more EMS systems institute alternative response options such as the EMD Omega protocol, or implement community paramedicine programs or treat no transport programs, it's vital that EMS agencies work closely with their medical director and put evidence-based, medically valid policies and protocols into place to guide these new types of EMS delivery models. A little bit of planning, foresight, and prevention can reduce the risks of a patient abandonment claim against your personnel. Thanks for watching.